What is that?
Well, coordinated benefits means that uh, the primary payer is your health insurance.
Okay.
Okay, say you have Blue Cross, for example. You're in a car accident. All the bills first go to Blue Cross, and then what they don't pay, it goes to your auto insurance company. Okay, that sounds good, doesn't it?
Yeah.
But
I'm pretty sure that's what
yeah,
I do, or that's what I have.
but it doesn't. Whenever you involve two different insurance companies, they tend to point fingers at each other to say, no, you're responsible. No, you're responsible. In many cases, I've been told that, yeah, the auto is primary, but it turns out that they're not primary. And even the insurance company thought that they were primary. Then they find out, no, it's your health insurance. So, it creates so much complication when you involve two different insurance companies.
Yeah.
And it can also put limitations on it. For example, if your provider that you want to see is not in network, then you're not going to be able to see them.
Okay.
So
Wow.
it's going to limit who you can see. It's also going to limit the kind of services like uh, case managers are often not covered under your health insurance.
Okay.
So you wouldn't have the benefit of a case manager. It's just much more limiting. Um, so
And
I
yeah,
was in,
people may not think about, they may not think they need that.
mhm.
Um, but the reality is, I mean, I was looking up some of the statistics, I wrote them down here, that last year alone, car crashes resulted in over 50 million casualties and 1.25 million deaths. That's from your blog. And then that doesn't even count for the people who survive a car accident and are left with both the physical and the mental
Right,
strain
right.
afterwards, right? I mean,
Yeah, that's worldwide. That number, 50, estimated 50 million. It's an estimate.
right.
Um, we don't know for sure, but there are so many. We have much better statistics here in the United States in terms of there being, uh, 3 to 4 million people injured each year in car accidents. Uh, Usually at least 40 million people killed in the United States each year.
Oh my gosh.
I mean, those are staggering numbers. And then it ripples out, how many family members are impacted by, a mother or a father who can't provide anymore. Or just the economic cost runs into, it might be approaching $1 trillion a year
Oh my
in the
gosh.
United States.
Yeah, just something like, I don't know, I never really thought about until I met you. And so it's opened my eyes to, and I really need to look at my coverage and understand, because it's not only, it could be a huge financial burden, which just adds more stress to everything else that you're going through after your car crash. So yeah, thank you. And I love how your book outlines all these resources, and like the case manager, for example. I didn't even know that that was really a thing. Um, so yeah, I guess you talked about last year and some legislation that changed, but from a global pandemic, like a virus pandemic standpoint, has it been more difficult for people to receive care after a car accident in 2020 due to the COVID pandemic? How have people been
Sure,
managing that?
for sure. Well, for me, it's been a good thing because of telehealth
Yeah.
and being able to see people remotely. It's actually been better for me in many ways. It
Yeah, you can
works.
see more patients probably,
You
right?
can
And they
see
don't
more
have to necessarily
people,
drive to you. And
right? You don't have to worry about people's cars breaking down or they're not, they have a cold today, so they can't come. So it's opened things up a lot. But in terms of physical coverage or physical accessibility, it's not been good because people are not getting the procedures that they need. It's been much more difficult for them to get procedures. Also, some people did not feel comfortable with virtual contact, and so some people didn't get services. So it has had a negative impact in many ways too.
yeah, it's 2021 is like, like, I feel like everyone thought, oh, the year's gonna change and everything's gonna go back to normal, and we're finding that's not the case. But I think things are starting to get a little bit better. But I agree, I think there's a silver lining with when it comes to telehealth and virtual care, that was never, it was kind of there before, but people were not as open to it because they didn't need that option necessarily. And now, now that they have that option, but yeah. Okay, so switching
It
gears a
was
little bit, how can
okay.
how can family and friends help support someone who is in a car accident? So we talked a little bit about this ripple effect, right? It's not just the person that's in the accident. It also affects family members, friends, everything else. But I think people don't know how to necessarily help someone, and they can encourage going to therapy, or something like that, drive them around. But what else do you suggest for family and friends?
Well, number one, to realize that they're also victims from the car accident, that they've been negatively affected. And it can, vary in terms of degree, but it can be really massive in terms of the anxiety and fear that a child might have that their parent no longer seems to be the same person.
Mm,
And if there's a traumatic brain injury, that's often what someone describes as I don't feel like myself anymore.
right.
Or, or if they're dealing with a lot of pain issues that takes away all their energy and they're depressed, um, the change in mental status can be very frightening. Or, family members can be angry and frustrated, also confused, they don't understand. So I would say, to number one, to get as much education and support as possible for themselves, and to realize that they have needs too. You can't fill somebody else's glass unless your glass is full, you
Yeah.
know, and a lot of people are uh, dealing with not having a lot of inner resources. So, to find support from friends, family members, colleagues, or mental health professionals is really
Yeah.
important.
Do you often recommend for your patients that to also see some of their family members? Like, is that is that also beneficial? Like you mentioned, if a mother gets in a car accident and she has little kids that are then affected, do you recommend that the kids also seek therapy, or do you do family therapy as well, or what do you recommend in that case?
Sometimes I do family therapy, or include as many people as possible in the treatment, or encourage them to find their own therapist if that's not feasible.
Right.
Yeah.
Yeah, I think that's so important, and something. Yeah, I guess I wasn't thinking they are victims too. I mean, it's like you said, a ripple effect, and they're affected as well. So understanding to help
And
yourself.
sometimes a whole family is involved in a car accident too. So you have multiple victims in in one accident. So
Yeah,
that can be really complicated. It can be helpful in some ways, but more complicated in others, because people dealing with different kind of injuries, and uh, it's just overwhelming. It can be really
right.
overwhelming.
So earlier you mentioned that when people are seeking out a therapist, that they should try to find someone who has experience with trauma
Mhm.
or with car accidents. So how do you recommend people to find those therapists available? Like, obviously everyone, I'm sure you have like a waiting list and everything for you, but is there a place that people can go, or when they're searching for a therapist, like what should they be looking for? Is there some sort of, like, not certification, but something that would tell them like, hey, this
Oh,
person has experience with this type
well,
of care?
there is a certification for specialists in brain injury. That's CBIS, Certified Brain Injury Specialist, and that's a certification given through the American Brain Injury Association, which is a very, very good educational and advocacy group in the
That's
United
great.
States. But also, working with a very good case manager and a physician who is usually a PM&R, physical medicine and rehabilitation, is the main specialty that would be dealing with an auto accident injury, or sometimes neurologists or neurosurgeons. But the important thing is to find people who are what we call patient advocates,
Mm,
they're not just there to, do a quick and sterile examination, that they actually, care about advocacy for the person to see that they get the services that they really need. And that's a huge difference. Um, and it's hard to find the advocates, so you need to find the advocates.
Yeah. It's that empathy piece, right? Too, like,
Right.
yeah, it's so important to have your physicians on your side that can
Mhm.
help advocate for you, especially if you're not physically or mentally fully capable of doing
Right.
that. You're in a vulnerable position, so I think it is so important to find advocates in your physicians, but also like family and friends that you might be able to support you in that, finding that right person, or that right form of
Exactly.
care. So,
Exactly. And again, the case manager can be a very good advocate
so you said
because
that's
they,
not always included. So does someone request? Is it it's not automatically assigned a case manager? So does someone request for a case manager from their insurance company, or how do they find that?
well, again, I imagine it varies a lot from state to state, but in Michigan, case managers are often, you can think of them as a liaison between your providers, your healthcare providers, your attorney, and the insurance company.
Okay.
So the case manager, communicates with everybody, and often attorneys will have case managers that they work with closely. And so that's one way that you can get a case manager, is through finding an attorney. And I attended a seminar on trauma and legal issues a few years ago, and there was a insurance company lawyer there, which was really good. Usually you don't get insurance company lawyers willing to share their tips and insights. But he said something that I thought was profound, and that everybody needs to realize, that if you are in a car accident in which you're injured, you need to have an attorney.
Mm.
Okay. Um, Hands down, you need an attorney if you're injured. You need somebody to inform you of your rights,
Yeah.
and so that you're protected. Again, the problem is to find the right attorney, because I remember Attorney General Janet Reno saying, when she was Attorney General, that she believed 85% of lawyers damaged their clients.
Oh, no.
Yeah.
That's a
So,
horrible statistic.
it is, it's, but I think that's kind of true in general. There's, 15% or 10% of professionals, that those are the ones you really want to work with,
Yeah.
because they are the advocates. They do have the empathy, and they have the skills and knowledge. Um, so again, it's really important to find attorneys that understand injuries, they're empathic, they understand trauma, and they can guide you through the legal process.
Right. Yeah, I think people should know too that they can interview different attorneys. Like, they don't have to just go with the first person that they call. They can ask some of these questions to make sure that they're on your side, right? I mean, to try to filter out who's actually going to be working for them versus trying to just get money out of them. Um,
Exactly. It's important to remember that your attorney is working for you. You know, it's it's a partnership, a business partnership, uh, on one level, and so it has to be somebody that you feel comfortable with and trust.
right.
And when it comes to trusting attorneys, that can be a big issue.
Yeah. Well, like I mentioned before, if anyone is in a car accident and they need a guide and they have questions, this book is an absolute gem. It's just filled with so many resources, and also helps people feel less alone in some of the things that they're struggling. So, I should also mention that you have a Facebook group as well, and a community of people who have survived car accidents, and it's a whole community on Facebook, right? Do you want to talk about that a little bit? I think that would be helpful.
Yeah, well, that's a relatively new development, and uh, the um, the lovely person who wrote the foreword to the book, Angela Molyneux, who is a classical pop singer and songwriter who was in a very bad car accident. She wrote the foreword to the book. talking about her auto accident
Right.
experience. And so she's been helping, um, has really been spearheading the Facebook group for accident
That's awesome.
survivors. And we've had a couple online events, and it's growing really well. And we're getting a lot of really good questions.
Yeah.
Yeah, I would encourage people to join. There's a lot of different Facebook groups out there for PTSD, for pain, for accident survivors. So
Yeah.
yeah, the resources are out there. You're not alone. If you think you're alone, you don't have to be.
Right. Yeah. And the peer-to-peer connection and support, I think, is so
Absolutely.
important. As
So
someone who
important.
struggles with mental health challenges, just talking to someone else who's been through similar things as me,
Mhm.
it doesn't necessarily make it better, but it makes it more like, okay, like I'm going to be okay. And there's someone else that's going through this. And also resources swap and information swap,
Yes,
right? That's
yes.
like, so, oh, I had this lawyer who was amazing. And here's his information, or like, yeah, this is how you get a case manager, or here's a therapist, Dr. James Zender, like all of those resources. It's so important to get that validation from another human being rather than just googling like best accident lawyer.
Our brains change when we interact with one another, and that's why I do group therapy for accident survivors, which I just love, and the group members love it because they get so much. It's like a whole nother uh, level. It's a neural level, it's a social level, it's a spiritual level. Um, it's very powerful. So if you can find a really good group to, whatever your issue is, if it's you're dealing with depression or anxiety that's not related to car accidents, groups are so powerful. If
Yeah,
it's well run, you have a good facilitator.
I
Yeah.
can't agree more. Um, okay, so let's talk about the box a little bit. This is a
Yes,
collaboration that we're doing together.
I'm
So like I
excited.
mentioned, the book comes in it already. This is what it looks like. Um,
It's a
and
lovely box.
yeah, BroglieBox is the feature item is Dr. Zender's book. And then we also have a gratitude jar with a little pen and a little pencil and a pad. So this is kind of what it looks like once it's all filled up. I have my gratitude jar on my desk, and every day I write something I'm grateful for. And the days that I don't really feel like writing anything, I pull out one of my old gratitudes that I wrote, and I see that I wrote something that I'm grateful for in my own handwriting. It's very powerful and keeps things into perspective, and just makes you reflect on the things that you have. And I
Mhm.
think there's something, yeah, so powerful about that. We
Gratitude is gratitude is so central to mental health. I think that, if we focus on gratitude, it's hard to be overwhelmed with depression or anxiety.
Exactly. No, it's one of our 6 pillars, so it's so important. Another one is this
Love.
massage roller ball. And this is great because you talked a lot about the physical pain and the benefits of massage that people don't realize. I always thought massage was like a luxury, but the reality is, like, you, from chronic stress, you build up inflammation, and by actually massaging, it can help break that up and create more blood flow, and also just helps you connect with your own body, right? So I love this item.
And you get the endorphins and the endogenous painkillers going, and serotonin and all those positive neurochemicals.
Oh yeah, all the good stuff. We also have this essential oil. It's a focus blend. So it has grapefruit, lemon, peppermint, and rosemary. It's amazing. It smells so good. And you can put this in a diffuser, or you could even put it on the massage roller ball so that when you're massaging, you get that extra scent, and the massage, which I love. We also have,
Aromatherapy is so powerful. It really is. Yeah.
I think too, I read somewhere that scent is the strongest tie to memory. And so if you're having bad memories, and then you can reassociate or pull yourself out of that memory with a scent, because it can
Mhm.
relate you back to a positive experience. So I think if you learn how to really hone in and utilize aromatherapy, it can be really beneficial, as well. So yeah,
For sure.
I love that scent. And then you also picked these blue light blocking glasses. I should have them on because I'm in front of my computer screen. but these are great for if you're looking at the computer or your phone or your TV. It blocks out the blue light, which can be very damaging and
Mm,
cause a lot of strain to the eye, can cause headaches.
mm, mm.
Um, so yeah, that's the
Yeah.
product. And then we also have our Alleviate Anxiety magazine. So here at BroglieBox, we have a network of over 30 mental health professionals that write for us. They contribute in the form of actual articles and then also help us with our resource section. So we have like a whole resource section that has different apps, books. There's obviously like crisis text lines and suicide prevention hotline information in here as well. But yeah, it's just a great resource. Like, here's an example article, like what's the difference between a panic attack and an anxiety attack,
Great.
and why is that difference important to note, and then what to do about it. What do you do if you
And
have,
so many people with car accidents have panic attacks afterwards.
yeah,
Yeah.
it's like, I mean, one thing just from doing this like some of the research that I've done, just starting the company and everything, one thing that helped me in my panic attacks is like holding an ice cube, and the
Mm,
change of temperature, it like jolts you out of it. It's just like little stuff like that. It's all jam packed in this magazine. So you have, two really amazing educational resources in this beautiful care package, and it comes wrapped in tissue paper. You can put a personal note, and yeah, I'm super excited about it.
oh, that's so lovely. Thank you for putting it together. It's beautiful.
Yeah,
Yeah.
I can't wait to
And
share it with the world. So I guess, are there any last thoughts that you want to leave everybody with?
I guess a couple things. You stimulated a lot of thinking by going through the items in your lovely box that you put together. But you know, we have all these different parts of the brain, and when you stimulate one part of the brain, um, it changes, the dynamics. So you talked about the scent and how the olfactory coming alive can trigger memories, and so every area of the brain can we can work with that and can trigger it. And so I think the items in your box gives a nice spectrum of different modalities. So
Well,
I
thank
think you
you
did.
for choosing them because you picked from our product
Well,
directory. And those are the
we
ones
did it
that,
together.
yeah, no, I think it's
Yeah.
so lovely and I can't
Well,
wait to get it out in the world.
I'm so honored. I'm so honored to work with you, and thank you for all you're doing.
Thank you. All right. Well, if anyone wants to connect with Dr. Zender, do you want to give you have a website? It's just it's Dr. James
I
Zender.
do.
Go ahead, you tell it.
Doc- Yeah,
Yeah.
drjamesender.com. Yeah.
Yes. And BroglieBox is brogliebox.com. We're also on LinkedIn, Instagram, all the social media outlets out there. And yeah, thanks for anyone listening in. Thanks for joining us. And yeah, comment below if there's any questions. We're happy to answer them. And remember, you're not alone, and there's resources out there.